The specific way in which the president is failing now is clear. When he is talking about the coronavirus epidemic, more often than not, he is lying. And it's making people around the country count on the fact that the federal government is doing that stuff when they're not. These daily briefings from the White House are a litany of things from the president that would be awesome if they were true, if they were happening, but they're not. If it were up to me, and it's not, I would stop putting those briefings on live TV because it's misinformation.
What do you say the Americans were scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it.
The president feels optimistic about something, his feeling about it. What I'm saying is that it might be effective. I'm not saying that it isn't. It might be effective. But as a scientist, as we're getting it out there, we need to do it in a way as while we are making it available for people who might want the hope that it might work, you're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
Is there any reason
From the briefing earlier today, you seem to dismiss the suggestion that chloroquine, an anti-malaria medication, can have much of an effect.
I'm not dismissing it at all, and I hope that interpretation wasn't widespread. What I said is that we don't have definitive proof that it works. So what we need to do, since there are suggestions anecdotally that it works, try to get it available, but to do it in the context of a protocol where we accomplish two things. We make something that's maybe hope and promising for someone. At the same time, we determine whether or not it's safe and whether or not it actually does work. I wasn't dismissing it. I was saying we need to be careful.
I don't see any harm in Trump's trying to give the American people a reason for hope that we will find a treatment and a cure for the COVID-19 disease. People who are fair-minded can see that Trump is not a medical expert, but that he has highly regarded scientists working with him, and that at the end of the day he relies on their analysis. It does bother me, however, that he brags about how great the economy was before the health crisis required us to temporarily close many businesses. The evidence is that this is not true. It doesn't do any good to try to bullshit the public. First, America is near the bottom in life expectancy among the developed countries of the world. Midlife mortality has reached its highest rate since World War II. We have many deaths caused by economic despair, including alcoholism, drug overdoses, and suicide. Second, the median wage of a full-time male worker is 3% below what it was 40 years ago. Worse, the median wage of the black male is 75% of the white male. Third, what growth there has been during Trump's presidency is not environmentally sustainable. Trump has cut many safety regulations. Ultimately, this will make the air less breathable and the water less drinkable. Fourth, the tax cuts were supposed to create new investment. Instead, they resulted in an all-time record of stock buybacks, which artificially inflated the stock market. They also resulted in a larger budget deficit. The tax cuts have made America weaker, not stronger. Fifth, Trump promised to increase manufacturing in the United States. The fact is, the rate of increase of manufacturing is lower than it was under Obama, who was indisputably a disaster for the American worker. In addition, while the unemployment rate has fallen, the rate is still above the unemployment rate in most other developed countries. It also bothers me that Trump has started to argue that shutting down the economy as a cure for the coronavirus disease is worse than the disease itself. Obviously, we do not have a full measure of the risk posed by COVID-19. However, it does appear that COVID-19 is highly infectious and has a high lethality rate. This, at a minimum, warrants significant safety measures, at least until more is known. On the other hand, the propaganda has begun that widespread economic hardship is itself a public health issue. There is, however, no real evidence that economic downturns are associated with increased mortality or other negative health outcomes. In fact, while suicides increased somewhat during the Great Depression, deaths from heart and kidney failure declined, as did deaths from tuberculosis, the flu, and pneumonia. Further, life expectancy rose from 57 in 1929 to 63 in 1933. To be fair, some of this is probably attributable to advancements in sanitation, hygiene, and health care made at the time. Nevertheless, the argument that short-term economic hardship will hurt the long-term health of the American economy and people has no support in the evidence. It is at best self-interested speculation, at worst cynicism. That said, I do not doubt that Trump or anyone else in the government or any other government is doing his best with a very difficult challenge to help the people. Further, I do not doubt that he is sincere in his desire that we can come through this crisis together and without having lost too much. Governments are always slow to respond to crises and then inefficient in those responses. Government is a human endeavor. Imperfection is part of the equation. I mention this because it strikes me that it is possible to interpret our response to the coronavirus as a drill. This is not to suggest that the disease was created in a lab and then set loose on society by a Dr. Evil, so that a team of social psychologists could study how the politicians and the public respond, and not for the sake of this one event, but to devise a system of order while carrying out a much more diabolical scheme. Instead, it is enough to note that our response to this global crisis provides invaluable data for hypotheses in crisis management. For example, let's take the fact that the masters of the universe see the economy as nothing more than utility implemented. In broad strokes, the population can be divided into 4 categories of value measured by wealth and income. The upper 10%, which is divided into the 0.1%, the balance of the 1%, and then the balance of the 10%. These people are basically the owners. After this is the next 20%. This is mostly inherited wealth and middle management. Next are the hardworking high achievers, the 40% in the middle, people who follow the rules, professionals, people in math and science, administrators, and skilled labor. Finally, there is the bottom 30%. These people are less motivated and less well-behaved. This is unskilled labor, the unemployed, retired and imprisoned poor, and people who are infirm and disabled. Mind you, I'm not making any value judgments. This is just a look at the population from the point of view of people who only think about money. Now, assume that the masters of the universe came to the conclusion that 8 billion people is too many people on the planet. From there, the conclusion that it would be beneficial to reduce the population to cull the herd, so to speak, is obvious. Now, couple this inference with the Darwinian myth that only the best and the brightest rise to the top, and therefore best serve the interests of humanity. You're forced to conclude that the people who are the least useful are the ones who should be eliminated. This would take out the Lucky Sperm Club and the bottom 30%. Of course, it would be impossible to perform such a surgical eradication. Some people in the bottom 30% would survive, and some people in the middle 40% would perish. This is probably acceptable because even with a reduced population, you'd still need some people to do the work done by the bottom 30%. Some in the middle 40% would be pressed down into the bottom group. As a side note, forcing people in the middle down would also provide data to test whether achievement is a matter of genetics or environment. If it's the latter, I'm not sure that the masters would see the evidence because this whole endeavor is tainted by a confirmation bias. But I digress. I would be remiss not to notice that the least useful people are those at the top. They literally bring no value to the table. Most of them are where they are because they are criminals. Unfortunately, they own the law and they are unlikely to implement a plan by which they themselves would be eradicated. In any event, it does appear that with a carefully targeted virus, it would be possible to eradicate about half the world's population and to do so with very little social unrest, provided a programming model of behavioral control can be developed. It appears from this coronavirus drill, the people who are already well-behaved can be relied on to continue to be well-behaved. Of course, with dramatically more deaths, control would become more difficult. However, the power structure has learned how to hide war from the public and has nearly complete control of the media. It would be far from impossible to modulate the flow of negative information to maintain a balance in the public between fear and the instinct to fight back. Getting back to the situation at hand, it is somewhat akin to trying to sell a car with worn tires. Because the tires are worn, the value of the car is lower than it would be if it had new tires. However, if we buy new tires for the car, we probably won't get the cost back in increased value. Instead, the new tires would largely be a sunk cost, but which is necessary in order to sell the car. As a result, the cost is properly put in the perspective of all the money we will spend in our lifetimes. In that light, it is obvious that the money is not enough to worry about. With the limited information we have at this point, we are at a disadvantage. We have to have faith that the reports about the nature of this virus are on the level, and as such, we are forced to do what is necessary to get through this difficult time. It goes without saying, however, that if Dr. Evil were running a drill, he wouldn't tell anyone. The point of such a drill is to find out how the politicians and the public will react to what they believe is a genuine crisis.